Good morning, everyone. My name is Morgan Eastman. I'm the Communications Manager for Thriving Together North Central NCW, previously NCACH. That is a mouthful. I'm going to have to get used to saying our new name. Welcome to our April partner convening. We have special thanks to Renew for hosting our in-person attendees. And if you are joining us online, feel free to chat in your name and your organization. I think we sent out an agenda attached for all of our Zoom attendees, and then we have some here in person, but the session focus today is going to be on youth-related behavioral health resources. So we're just going to go ahead and dive in. Mariah is going to do a land acknowledgement for us this morning.
We acknowledge that we are gathered in the historical homeland of the Swashino or Moses Columbia people of the Confederated Tribes of the Cabo Reservation. The Swashino, which means people living on the bank, lived mainly along the east bank of the Columbia River. The traditional territory of Moses Columbia consisted of approximately 4.3 million acres. This area is roughly bordered on the north and west by the Columbia River and extends to the south to the Potholes Reservoir and to the east towards what is now the Ritzville area. We recognize the harm and injustices that forever changed the lives of Chief Moses, his people, and his descendants. We offer this land acknowledgement as a commitment to learning more about the land, history, culture, and relationships with the tribes that make up the Confederated Tribes of the Cabo Reservation, and encourage all to learn more about the indigenous peoples of the places you now call home. Carelon has shared in the chat a link for those of you joining us virtually. If you can go to that link and chat in your name, organization, and the traditional territory that you are joining us from, then you'll go ahead and get started. Thank you all.
Well, again, I'm Morgan Eastman. I'm the Communications Manager at Thriving Together NCW. I'm sure most of you know by now that we just launched our rebrand in the last couple of weeks. And so I just kind of wanted to give a quick update. Some of you might have seen the newsletter that we sent out kind of explaining the story behind our rebrand, but I just wanted to touch on a couple key points here and just kind of talk through that. So over the last couple of years as an organization, we've really decided to broaden our scope, and we've tried to center ourselves and become more push beyond just a Medicaid transformation driven project. And so we're really focusing on health and wellness as a whole and all of the different vital conditions that are needed for people to thrive. So last year, our board announced that we did adopt the vital conditions, which I'll touch on in just a little bit and kind of loop that into today's conversation. And then we've also been diversifying our network. So working with a lot more organizations, grassroots organizations, different community organizations, in addition to our clinical partners as well. So really trying to make sure that we're hitting all of these different vital conditions in the groups that we're working with. We have a new website that is live. If you haven't checked it out yet, I encourage all of you to go to thrivingtogether.org. We have a lot of really great new resources for our partners. We have updated information, of course, on all of the projects that we're working on. We have a couple feedback forms on there. I wanted to highlight one of them we actually have under our partner convening section. So if you have a topic that's interesting to you for a future partner convening, we welcome you to share that with us so that we can make sure that we are choosing topics that are of interest to our network. We also have a designated page for funding, which we didn't have before. And we have a lot of other great resources like where to find Narcan. So definitely lots of good stuff for all of our partners and for the general public as well. We do have a couple of pages that will be launching in addition to what's already up in the next couple of weeks. We have an equity page that'll be coming soon, and then a few other resources for partners. So over the next couple of weeks, you'll see more on our website. And as I had touched on just previously, we adopted the vital conditions last year. And essentially, it's a framework for better understanding kind of the big picture when it comes to health and wellness in our local communities. And so for those of you who don't know, there are all these vital conditions that you can see on the screen: reliable transportation, thriving natural world, basic needs, humane housing, meaningful work and wealth, and lifelong learning. And so today for our partner convening, the two that we're really going to touch on are basic needs for health and safety, and then belonging and civic muscle. So you can see that the basic needs portion involves, you know, things like access to clean water, a place to sleep, nutritious food, health insurance, and access to healthcare services are also considered a basic need. And so today we have speakers who will talk about, you know, points throughout the healthcare system when people are in crisis and experiencing a need for those services. And then belonging and civic muscle is related to feeling a connection to your community. So, you know, access to those community spaces, a connection to peers, social support systems, and then really feeling that connection to your community. So with the youth focus today, we're going to be basically looping that into creating conditions where our youth can thrive. So the two vital conditions that we're talking about today will really help us understand that part of fostering that sense of belonging with those social programs, peer-to-peer mentorship, including creating inclusive spaces and those type of things. And then for the basic needs, being met through health and safety, the local workforce in our communities that can provide behavioral health services at every touch point from prevention to crisis. And we have our first guest speaker, Carelon Behavioral Health, that I'm going to pull up their slide and see. I think that'll just transfer right over. So we have Brian and Crystal and Leah this morning.
Crystal and Leah are meeting with us virtually here. Good morning, everybody. Again, my name is Brian Rebar. I'm with Carelon Behavioral Health, formerly Beacon Health Options, as of March 1st. And we're going to be sharing a little bit about that rebranding effort and that shift from Beacon to Carelon, as well as you know, our youth focused programs and community forums. And we're also going to be sharing about the continuum of care. And again, my name is Brian Rebar. I'm the community engagement coordinator for North Central Washington. What that means for me is I convene the Behavioral Health Advisory Board, the Family Youth System Partner Roundtable, the Community Partners Committees as well for children's long-term inpatient, as well as oversee the block grant funds for substance abuse and mental health programming in North Central. And I'm going to pass it along to Leah to introduce herself.
Good morning. Thank you for having us. My name is Leah Becknell, and I'm also with Carelon Behavioral Health, formerly Beacon. I serve as the account partnership director, and I have responsibility for really kind of all of the different programs and the financial stability for the services that we offer in North Central and Southwest region. Our role is primarily crisis services through our contract with the Healthcare Authority. But as many of you know, we have quite a range of different services, and we're excited to share some of the things that we're doing that are youth focused today. Thank you again for having us, and I'll turn it to Crystal.
Good morning, everybody. Crystal Eshelman. I'm a program manager with Carelon Behavioral Health. I primarily oversee our federal block grant funds in the 3 regions that Carelon is in. We'll talk a little bit more about that in the next couple slides. Brian, are you doing the slides there in the room, or Morgan? Go ahead.
Did you
okay.
keep enough up, or I can? Okay. Yeah,
Perfect.
just when you need the next slide, just let me know and I'll.
All right, perfect. So as Brian mentioned, Carelon is going through a little bit of a rebrand as well. So we are now Carelon Behavioral Health. We were formerly Beacon Health Options. We changed our name on March 1st of this year. So it's been almost 2 months. And Carelon is a brand that several businesses have joined under our parent company, Elevance Health. We are the behavioral health arm. There is a pharmacy arm. There's some other kind of healthcare related businesses that are all coming together to really deliver whole person health to our clients. And as you guys can hear us say, it's Carelon. We have the pronunciation on there. And the name is derived from care and lawn, which means full and complete. And so together, our name stands for the importance of providing full and complete care. Go ahead and go to the next slide. So we did provide just a little bit of information about that. This is purely a name change. If you guys have worked with us in the past, there's nothing that is changing. There hasn't been any staffing changes. There's no ownership change or anything like that. Our contracts and policies and procedures, everything stayed the same. Same with our phone numbers. They stayed the same. Our emails and websites are redirecting to our new domain name. So we just wanted to reassure everybody, if you guys have been working with us, that everything is the same. You have the same contacts and everything. Go ahead and go to the next slide. So we just wanted to share a little bit to start with about Carelon Behavioral Health in Washington and what we do here. For those of you that aren't familiar with our role, we are the Behavioral Health Administrative Services Organization. So we are contracted with the Healthcare Authority to be the BHASO in North Central, as well as Southwest and Pierce County. So in North Central, it's our 4 counties: Chelan, Douglas, Grant, and Okanagan. In Southwest, it's Clark, Klickitat, and Skamania counties, and then Pierce is its own region. And on here we have, at the top, we have our primary responsibilities as the Behavioral Health Administrative Services Organization. We maintain the crisis system. We also support the behavioral health safety net and lead community forums and system development. So I'll talk a little bit more about those in a minute, but I want to bring your attention on the right, where it has kind of the philosophies that we support, the things that we like to keep at the center of the work that we're doing, no matter what program we're working on or what services it is. So first and foremost, I would say that we want to be person-centered. We want the person to be at the center of any programs that we're developing, thinking about how services are delivered. We really want to be focusing on the person. We support a harm reduction approach. We obviously are very supportive of, treatment and recovery and getting folks into those phases, but we also understand that not everybody is ready for treatment or recovery at certain points in their life. And so we do support harm reduction as well. And an example of that is the Narcan vending machines that we've partnered with Thriving Together to implement in North Central. We do both facility-based and field-based intervention, or we support those, both those types of interventions. And I think the field-based intervention has become a lot more prevalent in our work with the Recovery Navigator program that's been implemented recently. And we've also been working a lot more on co-responder programs throughout our regions. We support evidence-based, promising, and emerging practices. Of course, we are interested in supporting evidence-based practices, but we are also interested in supporting and working with our partners to be innovative and come up with new ideas and try new things to address problems that we still have and need to work on. And we support a no wrong door approach. We, no matter where an individual touches the system, we want them to get the care that they need. And lastly, local and regional application of resources. And we do work with different advisory boards and forums throughout the region to make sure that we are trying to address needs and gaps that are in the region. Go ahead and go to the next slide. All right. So this is our 3 main functions as the BHASO. Again, we maintain the crisis system. We coordinate and fund a 24/7, 365 crisis response through our regional crisis lines, mobile crisis teams, and DCR services. And these services are available to anyone, regardless of insurance status and income level. We oversee the Involuntary Treatment Act for mental health and SUD. So we're responsible for the application of mental health and substance use disorder involuntary commitment statutes to conduct Involuntary Treatment Act assessments and file detention petitions. And lastly, in that first bucket, we are also responsible for non-Medicaid individuals that enter the crisis system and provide care coordination and care management for non-Medicaid individuals, including those that are uninsured, to connect to ongoing services and resources. In that second bucket, under supporting the behavioral health safety net, we have quite a few programs, and this is definitely a growing area for us. First off, we have the housing and homeless services. These are relatively new within the last couple of years, and we have a housing program manager who administers these programs. In North Central, we have the Community Behavioral Health Rental Assistance and the Governor's Housing and Homeless Fund, and both of these are focused on supporting individuals with behavioral health needs into housing, into long-term housing. And then we have the Justice Support System Support Programs. We've kind of grouped all of our programs that support individuals who have touched the justice system into this bucket of work. And our program manager is Jim Jensen for this work. He oversees the Recovery Navigator program, which is a field-based peer-led case management program And the priority population is law enforcement, diversion, and social contact referrals. Under this work, there's also our jail transition services and criminal justice treatment account work that supports individuals who are incarcerated to receive behavioral health services while they're incarcerated or transitioning out of incarceration. And also our assisted outpatient treatment, which is behavioral health treatment with court oversight for individuals with severe behavioral health issues. This is a new program that we're hoping to launch in North Central in the coming months. There was recently an RFP that Jim has done, and so hopefully that program will be getting going soon. The last bullet point in this bucket here under behavioral health safety net is to enhance behavioral health and social support systems. And this is really where we lump our support for and underinsured individuals who need mental health and substance use disorder services. A big part of this is administering the federal block grants for substance use and mental health as well. And then under that last bucket is lead community forums and system developments. And Brian and Leah are going to talk about the Behavioral Health Advisory Board and some of the youth forums that we have. I just wanted to touch on the crisis collaboratives. We do have 7 county-specific crisis collaboratives in North Central. We have 3, one for Chelan, Douglas County, one for Okanagan, and one for Grant. And the overarching purpose of these collaboratives is to clearly define and articulate the crisis system of care, identify gaps, and develop strategies and solutions to help address gaps in the continuum of care. These are open to the public, and if you're interested in attending, there's information on our website, or you can reach out to any of us to get involved with those. So now I'll hand it over to Brian to talk about the FYRE.
Okay, so one of the community forums that I convene is called the FYRE, which stands for Family Youth System Partner Roundtable. Like I said, it's a public community forum, brings youth and families together with the system partners and the different agencies that provide youth and family behavioral health services in our region to really work on improving the system, identifying different barriers and gaps and issues that might be present, and also serving as a place for advocacy for youth and families who don't know how to navigate the system, because that can be confusing and difficult to do. And this is a place for them to voice concerns and issues and troubleshoot different things they're dealing with. In addition to kind of serving that purpose of advocacy and guidance and navigation, the FYRE also offers a lot of different trainings and presentations on different youth and family focused topics related to behavioral health. And the big purpose of this is, a lot of it has to do with informing youth and families of available resources to them, things they have at their disposal that they might not be aware of, but also to empower and educate them to really take an active role in their behavioral health journey. This is also another purpose of the FYRE here is to really have discussion surrounding, involve the youth and family voice, these 3 different elements, right? The family, the youth, and the system partner, all of those voices, making sure they're present in the discussion of improving and evolving the behavioral health system for youth and families. And so, as I mentioned, the FYRE is broken up into family members, youth, and system partner. Family members are parents and guardians of youth who have utilized behavioral health services, or if they themselves have utilized it. And youth, the age range is between 14 and 25 of youth who have utilized behavioral health services. And this can be directly or indirectly through close friend or family member. And system partners, right? So the representatives, the different agencies in the network, the behavioral health network, who specifically support families and youth. And next slide, please. Oh, and one last bit about the FYRE is we have tri-lead representation of each of these 3 individual pieces. Currently, we have 1 system partner tri-lead, which is Dee Cummings with Pathways to Parenting, and then 2 family tri-leads, which is Stephanie Skidmore and Amanda Edwards, and our youth tri-lead, Arden Paglia. the Behavioral Health Advisory Board. So we recently did a lot of revamping and reevaluating of the BHAB's mission and of how we receive public comment and what we do with that. Because as an advisory board, we wanted to take another look at how we do that to see how we can improve it, improve our systems and our processes for making this beneficial. When not just receiving that public comment and holding on to it and not really knowing what to do with it, but being able to have a process for analyzing for patterns and trends, identifying those patterns and trends, and then sharing it back out in a productive way. And part of that revamping was really taking a critical look at our mission statement. And so this is our new mission statement: to identify and break down barriers related to access to behavioral health care and meet with stakeholders to advise on trends, quality of care, and other related service issues in the North Central region. And so the BHAB meets monthly, much like the FYRE. And each month we release a request for public comment catered around a specific topic that the main presenter is presenting on for that month. And that public comment request is spread throughout different media outlets, it's spread through different networks. And we also have an electronic form on our social media page that we receive public comment through as well, in addition to inviting people to a dedicated time slot during the meeting to share out that public comment and add to the discussion. And that's kind of the main medium through which we identify barriers for access to care within the system. And then through that process of receiving it, we have a tracker with different metrics that we take a look at, analyzing those patterns and trends. And the kind of final step in this process is to share it out semi-annually to a group of governing bodies, commissioners, different entities and people who can work towards change at that higher level or that legislative level. And another main purpose of the BHAB is to review the block grant project plan each fiscal year. And the block grant project plan is basically all of the providers that are going to be supported by the block grant funding through the coming fiscal year. We're actually doing that right now. Just finished the draft for the block grant project plan for North Central Washington, and we'll be sharing that out at the BHAB on Monday, actually. Yeah, I think that should be it for the BHAB. I will go ahead and pass it along to Leah.
Great, thank you, Brian. What I'd like to do is share a little bit about the Youth Navigator program. So this is not active yet, but coming soon. And given the focus on youth for this particular forum, I wanted to make sure that I had a chance to share this exciting program that's coming. So the Youth Navigator program goes back in time a number of years to 2018, where Pierce County under Marybridge Children's Hospital took the lead to build the Kids Mental Health Pierce County program, with the concern in particular around how many youth and children were essentially boarding in an emergency department at the hospital, where there was no place for them to go, and they were ending up in these emergency room situations for days, weeks, sometimes even longer. So that's kind of the history of where this program started. The healthcare authorities identified this as being a really promising program and opportunity, and so started in 2022 with rolling out to 3 additional regions, including Southwest, Salish, and the Greater Columbia regions, and operating these under the Behavioral Health Administrative Services Organization. North Central is targeted to start this July, so I know that's just right around the corner. And then the intent is that across Washington State, all regions will have Youth Navigator programs in 2024. So next slide, please. So, as I mentioned, this is really around addressing this growing challenge of youth and children at the emergency rooms. The idea behind this program is how do we bring together the various individuals and agencies across the region and help address that child who's in need. I mentioned it's funding through the Healthcare Authority, and it's delivered by the Behavioral Health Administrative Services organizations. We're still in the process of identifying what are the exact metrics that we're tracking. With any program that's successful in one county, you think about, okay, how do we extend that to multi-county regions across the state? But really looking at how do we reduce both the number as well as the severity of behavioral health issues in school-age children, K through 12 grades. This is around Southwest, so coordinating, connecting youth to those different behavioral health services in ways that hasn't been done in the past. We bring together a variety of different individuals, so might be hospital staff, might be developmental disability organizations, DCYF, any other local agency that predominantly serves family and youth is invited to be part of this program and participate in helping families identify how they can change the outcome for their youth with high needs. Next slide, please. So there's really three components to the services. The first is a really comprehensive website that has a number of different resources that's tailored to the particular region. So this is not a generic state one, but really, pulling together exactly what is available, in this county, in this city, in this town, that can help address behavioral health needs and focus on, how can we bring whole child care together. Also that, might take the form of collecting all of these programs and flyers, whether that's summer camps, support groups, FISPER, anything else kind of thing, but just really kind of pulling that all together in one central location. And then updating it regularly. So this is not a static website, but one that, is constantly reviewed and updated. A core component of the Youth Navigator program is this concept of forming multidisciplinary team meetings, or MDTs. And so this is really, wrapping around a youth in need. So really pulling together all the different resources and individuals, including the family members, the youth themselves, any natural supports that this youth might have, and really working through, what can we do for this youth that really will change the outcome and address underlying issues and put them on the road to long-term recovery. And then the third component is the team does, intensive follow-up care and case management, and looking at, how long that is, but it's very intensive in the first couple of weeks after the multidisciplinary team meeting, while we look at, okay, a lot of great ideas were thrown out, how do we make those really happen? And then, kind of transitioning those into ongoing care management, but continuing to check on the family to make sure that all their needs are being met, and then kind of gradually phasing out of that intensive case management. Next slide, please. So I'd like to share, we're really just up and running in Southwest. So we started March 1st. And with getting referrals, and in that first month we had 10 referrals, and we held 4 multidisciplinary team meetings. That wasn't that the other 6 didn't warrant a multidisciplinary team meeting, but as looking at what was the best way to address that referral, we decided that an MDT wasn't necessary for that, and so moved on with providing services without that. We've had about 25 people attend each of our MDTs, so quite a few resources available, and really kind of getting there to support this youth. We saw a lot of referrals from our rural county, Klickitat, and fewer from Clark County, which is more populated. Then I think that speaks to the challenges in many of our rural counties where there aren't as many resources available. And so, we're kind of analyzing, what can we do in Klickitat County to support youth better going forward and not have them get to this level of acuity. We also kind of tracked insurance. I mean, I think the graph there just really shows that, it's all over the map, right? From Medicaid organizations to commercial insurance kind of thing. There's lots of kids in need. And I think one of the things that we're particularly motivated by is that we had an urgent MDT, so that we schedule those in 24 to 48 hours after we get the referral. There had been a youth that was at an emergency department for 2 weeks and just languishing there, and actually not even in a room because the emergency departments are so busy sometimes they couldn't find a room. So literally in the hallway for 2 weeks. And we were able to pull together an MDT. The youth participated in that MDT from the hospital. They were a teenager. And we were able to put a plan together and discharge that youth the following day. And they haven't returned to the emergency room since then. So, we don't know what would have happened if we hadn't been there, but we really think we made a difference in that youth's life. And then there's a quote there that just is a note from one of the principals from one of our schools that's been participating. So, we're really excited in Southwest region about, the early results and opportunities, and, can't wait to bring this to North Central. These are our own staff. So we have a staff of 3 who manage this program in Southwest, and we'd be looking to build that same staff and program in North Central. I saw there was a note I'm talking, so it's hard for me to talk and read chat, but the funding is supposed to be added to our contract July 1st. It will take us a little bit of time to staff the positions. We think we'll be able to go more quickly in North Central because we have policies and procedures in place already that we think are adaptable to North Central region. But getting the staff in place and forming those MDTs and really and putting that website together will take a little time. But I'm really hopeful that fall, by the end of the calendar year, we'll be accepting referrals in North Central region as well. Next slide, please. I just wanted to, that changed colors. That's funny. I just wanted to leave folks with, kind of our philosophy from Carelon is really important to think about the whole behavioral health system continuum of care. Where our role is primarily around crisis services, and we're kind of in that red zone in the middle, the acute intervention when someone's in crisis. If all we do is focus on crisis, we'll have a lot of people in crisis. And so we want to make sure that we're constantly looking at and working with partners on how we can intervene sooner, how we can prevent youth and families and adults from even moving into a crisis situation. And then we want to make sure treatment is solid, and that for individuals with high needs, that we focus on recovery and reintegration so that they can remain stable in the community and not return to crisis. And so this is something that we keep in mind on a regular basis around, why is it that we're here, and why do we partner so readily with so many different agencies, as we can't do it all. It really takes the whole community to be thinking about these various components across this continuum of care and meeting individuals and their needs along that continuum. And then the bottom section, I won't spend a lot of time on that. I know we're getting on time, but just important to think about, having individuals with lived experience, for example, part of thinking about what this continuum of care looks like. And some other components that really have to be in place in order for this continuum of care to really be full and complete and serve the needs of the community. I think that's our last slide. There's our contact information with our new emails. So thank you for the time, and I'll leave it to the conveners to say if we have time for questions or need to move on.
Yeah, I think, we have time for questions if there's any questions. Yeah, Del in person has a question.
Does this replace the regional children's committee that we use for clip placements, or is this over that?
It does not replace anything. It's in addition. We're kind of looking at whether we want to, pull that clip convening group under this, because there may be some overlap. But for right now, in Southwest, we still have the same clip committee reviewing any referrals to the children's long-term inpatient program. But I think we have to see how we want to integrate that ongoing. a requirement that the CLIP administration has at the state level, that there's a convening and reviewing for any referral. So we have to see how best to meet that with this youth navigator program in place. I'm hoping we have fewer referrals to CLIP, right?
Yeah. Thank you.
Great question, Tal. Thanks.
And Leah, just to make sure I understood, all of these programs that the three of you outlined are totally insurance agnostic, right? It's like,
Yes.
okay, awesome.
Any other questions? Yeah.
Yeah, so for the Youth Navigator program, since it started with Mary Bridges, does that mean here in North Central, is it gonna be in some of our hospitals, so like Confluence, or here in Grant County, like Columbia Basin? Or how would that look like? I may be getting too far ahead.
Is that you, Jerry? I can't see you, but I recognize your voice. It will be operated by the Behavioral Health Administrative Service Organization, so it'll be operated by Carelon, but it will be working closely with the hospitals, yes.
Thanks, Leah.
Sure.
And I want to recognize too, that Shelley has a comment in the chat. And there's folks responding to Shelley about putting it out about a group to host a convening of relevant school staff and partners in the community in the fall about the new mobile crisis for adolescents. And anyone that would be interested in joining her on that, Shelley Sessler is with the PSD. So
Thanks, Mariah. Then I think, was there a question?
I'm just curious, is it like a crisis line for hours, or is it like 8 to 5? What does that look like?
I'm sorry, I didn't hear the question.
Was the crisis line, is it 24 hours, Leah, or 8 to 5?
Yeah, the crisis line is 24/7. The mobile crisis teams vary in their hours. There's always the designated crisis responders available 24/7 to evaluate for involuntary detainment. But the hours of mobile crisis teams vary in each of our counties in North Central region.
Thanks, Leah. Any other, I think that, were there any others in chat that you could see, Mariah?
no other chat questions. Anyone else online? Have a question or comment?
Great, thank you for your time.
Yeah, thank you so much for Leah, Crystal, and Brian for presenting today. Gonna see if can get our tech issues streamlined. Let's see. And then I know that we have the team at Renew here to talk about youth mobile crisis. So let me see if I can get those slides shared. Okay, how does that look on Zoom now, Mariah?
If you can do the full screen down at the bottom.
Don't worry too much about our slides, we're not gonna match. But
Okay.
that's not the next one.
Okay, do you want me to just, you guys want to come up or?
Yeah. I just wanna say, Jared, everybody's happy to see you.
So do you want me to click this?
She's like, that's Jared.
Is that's better, Mariah? Okay.
So, good morning, everybody. My name is Anselmo. I am the crisis team supervisor.
And I'm Tracy. I'm the initial services manager, I guess.
So we were invited to talk about our crisis services and our crisis team, what we do. And so if we say something that doesn't make sense or use words that. With.
So, yeah.
So I know that our focus was is youth mobile phone, but I'm gonna start with like the makeup of our team and then break it down to. So our crisis team is made up of we have 5 DCRs. 4 of those DCRs are the ones that cover the on-call 24-hour, 24/7.
Designated crisis responders.
Yes. And then we have one of our DCRs that's set up with law enforcement. Rick, he works with law MLPD, 10-hour shifts, Tuesday.
Yeah, so he's the only DCR right now on our co-responder program. So he works Tuesday through Friday, 10-hour shifts. with law enforcement, he's able to work with them for the whole county. Right now, he's primarily with Moses Lake, but he's able to be dispatched throughout the whole county.
Law enforcement loves him, he loves him.
Yeah.
He gets the best, I don't get it. So those are DCRs. We also have five CIS.
Yeah.
So those are our bachelor level crisis responders that also respond in the community. And then we have 4 peers that provide the follow-up support services. So that is the makeup of our crisis team. So under our crisis team, then we have our youth team that has been around for
Not quite a year, I don't think, not quite a year.
So out of those 4 DCRs, we had, or no, 4
CISs.
CISs.
Yeah, 4 staff are assigned to our youth mobile team. So we have 2 CISs and 2 peers. So they're split up into teams, a CIS and a peer on each team. And their hours right now are Monday through Saturday, 8 AM to 1 AM.
So we don't have the staff yet to cover the whole week, but that is our goal. So right now we just try to have them on as much as we can to be there to at least 1 AM with the DCR. So usually what happens as of 11 PM or 1 AM, the DCR is out there by themselves, but we try to have those folks out as much as we can. So that is the makeup of our team. We provide 24/7, or we are located next door, next to the Renew building, open until 5 o'clock. We take walk-ins. We've been doing a lot of outreach, community crisis services. We're everywhere. We're, last week we're out in Mattawa Bridge.
Yeah.
So we go all the way from Mattawa up to Cooley. We're increasing our response just out of the field. We go to schools, jails, houses. Just try to keep it safe. We always do a 2-man team. Before we go out, we make sure that it's a safe field for the staff to respond to. If not, law enforcement has been very supportive, and they've been going out with us as well. When it's just doesn't feel safe, doesn't feel right, we just don't do it. We just let everybody know that, we're there, and give them circumstances we can, but we're trying to work on that though. What else?
So I mean, like referrals for our youth team specifically. So since it's like a team within our team, referrals are the same. So contact the crisis line, you can contact our office directly. And then we triage it to our youth mobile team, and then we would dispatch them from there. So same way you would get a hold of our agency for any other crisis is the same way that you would contact our youth team. But crisis line knows that we have a youth team on and available. So if you contact the crisis line, they'll let us know that it is a youth referral so that we can make sure we're dispatching the right staff.
I'm curious just what kind of information that you would want to have before you call the crisis line. Like, what are they gonna ask for in order to respond?
Yeah, so typically they want demographic information. So a name, a date of birth, some sort of location is super helpful. And then just a little bit about what's going on, like what in that moment is kind of the reason for the referral. So as long as we know like the basics, who it is that we need to contact, where they're located, and just a little bit about what's going on, we can make sure that we kind of take it from there. So it doesn't have to be tons and tons of detailed information, but we just like to know the basics. And then we're able to try to look them up. If it's someone that we've had contact before, we can kind of get more information that way, or just get the rest of what we need once we're there.
And you don't know the address, the exact address.
That's okay.
I mean, like, how does?
Yeah. And because a lot of times we'll get referrals from schools or doctor's offices, things like that. So as long as we know where the individual is located, or if we have a solid contact person that can help us fill in the blanks, we can use that as well. So if you have like a parent or a teacher, someone that can help us get the rest of that information, that's all we would need. Yeah.
Is the crisis line only open from 8 to 5 for calling?
The crisis line is open 24/7 for calls. Yeah, yeah.
One of the nice things is that she's the initial service manager, so she is the boss for the intake team, so we get intakes done right away. If not, she makes me do them. It takes a long time. So really good at connecting people, getting.
He's a pro, he's a pro.
So it's really nice to work next door to the intake team. Happy to do things.
Yeah, we're all kind of in that same building together, so we try to collaborate. If we see a youth in crisis or an adult, we make sure we try to get them in as soon as possible to enroll in services, so.
I'm sorry.
No, you're
What's the
good.
age group what the crisis line is intended for? Anyone or just you?
Anyone. So any age, anyone can call. If you do have like a youth, if they're just aware of the age, then that just lets us know which staff to kind of dispatch. But otherwise, yeah, anyone, any ages can call.
Is your crisis team located at the Moses Lake office, or are you guys spread out amongst all these offices?
We are
Our home base
located.
is next
yeah.
door, but I mean, we respond for the county as long as we have stuff.
Yeah. So it takes us a little bit longer to get to like Mattawa or Grand Coulee, but you know, we dispatch everyone as quickly as we can. But we're all here right now.
Are there questions about the crisis we guys have? We've been lucky to have bilingual staff.
Yeah.
A lot of, you know,
You're
half
lucky.
our team,
Yeah, I think we're, yeah, more than half the team.
really, really nice. Being in Grant County.
Yeah, we've been keeping our response times pretty quick. I would say an hour under, unless it's a little farther towards the outskirts of the county, it takes us a little longer to get there. But especially with our youth, you know, we get a lot of referrals from the school, so we're trying to get out there as quickly as possible, especially before school's out, so we can make sure we contact people. But we are staffed, we are lucky enough to be staffed now so that we can respond as quickly as possible with 2 people to keep it safe.
We are missing the adolescent MHP position.
Yep.
Tracy and I couldn't cover that for now. So we were able to find.
Yeah.
Anything else that would be quick? So we got Liam.
Good job.
You guys have any other questions?
We also have the WISE team here, which is nice as well. Those guys have some pretty hard clients and we're always working together. It's just running next door, they come to us. And check out.
Yeah, and I, along with that, I love the focus with the youth team, is like a longer duration for follow-ups. So we try to hang on to them a little bit longer than we typically would a crisis. So we'll try to hang on to them for maybe a week, 2 weeks, and just make sure that they've kind of stabilized, that they've gotten connected to all the services, resources, everything that they need before we let all the other resources kind of take over. A lot of times that is collaborating with the WISE team to make sure that they're all set up with their appointments, and everything. So.
Thank you so much.
There's a question in the chat, actually, just Shelley's wondering about response times for adolescents. What are they typically running, or if there is an answer to that?
I don't have the exact data in front of us, but I think it's less than an hour right now. We try to keep it under 60 minutes.
Did you guys hear that okay? Online.
Yep, thank you.
Any other questions in the chat before we move on? All right. And we can really go in any order next for the youth programs. Michelle, are you on and able to do a share screen?
I am on, and I can do a share screen as soon as the other share screen is down.
Give me one second. Okay.
Okay, let me try to do this. Can you see me? Can you see me yet?
Your screen, not yet.
Not yet. Okay, can
There
you
we
see
go.
me? Can you see me now?
Something is starting out. There we go.
Okay, is it in presenter mode? Or
Nope,
do you see?
Not yet. And now we see your notes, so just
You
swap.
see
the
notes?
Yeah, if you swap the display settings at the top,
Gotcha.
and you do swap. There you go.
There we go. Okay.
Perfect.
All right, that was good. Thank you, Caroline. Hello, everybody. My name is Michelle Sandoval. I am joining you all remotely here in Okanagan County, Okanagan lands. I am the co-founder and co-executive director for the Foundation for Youth Resiliency and Engagement. We go by FYRE. And today I'm going to be sharing with you, with this frame of behavioral health for young people, of what we consider to be behavioral health for young people at FYRE. And it's actually going to be everything that we do, because we do believe that housing is behavioral health. We believe transportation is behavioral health. We believe belonging is behavioral health. Identity is behavioral health. So you are going to get quite a big view of what FYRE does today. And we have Alexi Orr, who's joining you in person. So Alexi can give you all a wave for you in-person people. Alexi is our recovery coach and advocate. And so when I talk about advocacy, that's the work that Alexi does. So FYRE, we are a nonprofit organization out in Okanagan County serving young people ages 12 to 24. Our mission and vision is really about equity and access. And within our mission, we have this idea of thriving. We want to be a space where all young people have an opportunity to thrive. And what that means for us in terms of where we're going long term is that we want all young people in Okanagan County to have the opportunity for healthy minds, healthy bodies, and healthy homes, because we believe that is what a healthy community is. And so we do, when we're talking about equity and access, that does mean that we are prioritizing specific young people in Okanagan County. And that is because, as a founder and as a young person a former young person who grew up in Okanagan County, we know that opportunity for thriving is different for different young people in Okanagan County. And specifically, one of those areas is around race and ethnicity. So we do prioritize BIPOC young people, that's Black, Indigenous, and people of color. We also prioritize LGBTQIA populations because we do know that we are in a more conservative community. We prioritize systems involved young people, undocumented youth, and youth who have experienced harm in their lives. And we also prioritize our young parents. And so it's no surprise that those young people are represented well in the population that we serve. And in terms of what we do, the activities that we engage in. And so with our approach and belief, as mentioned before, it is important that we center the voices of the people that we serve. And so we center youth voice in a variety of ways. And I'll share with you specifically how we engage in those activities. And we also believe that with young people, everything is upstream. No matter if we're talking about our prevention activities or our reintegration activities with young people who are just as involved. All of those things are upstream with the young people that we serve because they are young parents. They are our future. They are the people who are going to be engaging in work and hopefully serving our community as adults. And so we do provide a continuum of care so that we can pull them into the stream whenever and however into our continuum of services. So that basically means, that we have young people who are highly substance use affected, who are coming in and just feeling safe in our space, just coming in to get Narcan, or we're doing outreach to give Narcan, all the way up to young people who are off going to university at Columbia, who are the voices and want to engage in work, advocating for undocumented people, right? So we're all the way through all of those young people. And we really want to center safety and access with an emphasis on harm reduction. And specifically, that means that what we have heard from young people is that in this age group is that they don't feel safe or supported in service spaces. And so whether that means when they go to the doctor's office and they're getting a sexual health test, that experience is not one that they feel comfortable oftentimes doing alone. And many of them don't have a parent that they can do that safely with. And so really trying to address those areas of like, how do we get you to feel safe in our space, but also other spaces that you need and that you're going to need throughout your life. So what do we do at FYRE? Our continuum of services includes everything from recreation and drop-in. Like I said, we do the drop-in for young people who are highly substance use affected, but we also do drop-in for under 18-year-olds so they can hang out in a hangout space that is safe and drug-free. And then all the way to some very one-on-one intentional work that looks like advocacy, and usually our population who receives advocacy, which you can think of as like case management, is usually those young people are 16 to 24. And we also hold really intentional and ongoing groups and workshops. So for example, we collaborate on a youth leadership council that does peer-to-peer education with another organization here in Okanagan County called Room 1. And those young people, we are following with them. We have seen them for several years, and we are really intentionally working with them in their day-to-day lives. And what is very cool is that young people in those areas are not just learning skills that, you know, are benefiting them in their individual lives, but they are learning how to be peer advocates. And that is true for both of the young people in advocacy and also the people who are formally getting trained in peer-to-peer education. We have seen, for example, our advocacy youth teach other young people how to get sexual health appointments, teach other young people how to get health insurance. And so we are seeing these benefits kind of occur naturally as well. And then just an important thing to realize about Okanagan County. Okanagan County is the largest county by land mass in Washington state and the most rural county. It is approximately 5,300 square miles. And so for us, it is very important that transportation and reliable transportation is an element of what we do. So we provide bus passes and gas cards, and we've tried to do our best to provide transportation for appointments and important things for the young people that we serve in advocacy. So I dropped in the vital conditions at the bottom here. Because I want to be able to nest what we do within these vital conditions, since it was touched on at the beginning. So yes, we do basic needs for health and safety. We have a youth supply closet. We connect young people to food, to the food bank. We connect people and help them navigate through the DSHS system, for example. And again, we're talking about sexual health safety. We're talking about drug use safety and elements of that nature. We also are working with young people on humane housing. And that means that we recently received funding to do rental assistance. And in the time that we've been alive, which is approximately 2.5 years, we've really seen our programming going from helping young people navigate housing provider services to receiving those dollars of our own so that we can help young people at their own pace. Because oftentimes what we're seeing is that the organizations we currently have supporting housing work aren't necessarily youth-centered. And so that means that these young people are having to work at the adult pace or with, you know, kind of that adult lens in order to transition to housing. We also do work around meaningful work and wealth. So we recruited somebody who was formerly at WorkSource, and we've begun to develop a program so that the young people that we're serving are connecting to careers in community health and able to do exploratory work in community health work. And so that means we're driving them to Job Corps, or we're helping them navigate that process. That also means that we are, you know, we're trying to get young people to be able to work through what it, you know, those federal employment programs, which are heavy paperwork burden for them. And so we try to keep them encouraged throughout that process with our employment partners. And we are still developing that program. And so we're just really excited about what that's going to look like long term. We also help young people with educational advocacy and encouraging them to think about education with a lens as a means to an end, because a lot of people that we serve aren't really feeling that safety and connection to education itself. And so really trying to figure out the other avenues to really relight that passion about learning is one of the things that we have a heavy emphasis on through our employment work and also through just like peer-to-peer work. Reliable transportation I mentioned, and then also essential to everything we do is this idea of belonging. So our space and our people really speak safety and belonging. That means that we have people who live and look like the people that we serve, and that our space is just shouting like, you belong here. This is your space. And indeed, that is what we have heard from many young people, that they wanted to visit FYRE because they wanted to know what it felt like to be in a space that was meant for them. So in terms of impact, I just wanted to share kind of the direct service expenses that we spend money on, because I think it's useful for other programs to kind of know that and see that. A lot of what we did in the first year and a half that we were alive, I guess, at FYRE was just person stuff, just that safety and belonging and being that connector. But we've slowly been able to receive more funding to provide more direct service dollars that are going in the hands of youth. And so those look like we're spending that money on relationship building. So that is something that is typically not funded by most funders, is like taking a young person out to lunch or buying them a coffee is not something that I can charge to one of our youth homelessness grants. Identification documents. So that is, many of the young people, if not most of the young people we see, do not have birth certificates, do not have identification. And so helping them kind of navigate that process. Also their fees for licenses. So they may have a license, but they don't actually have a physical copy, or even just paying for them to take their driver's license tests. Employment and education looks like we pay for GED testing, we pay for Job Corps exploration, and we pay for the actual trip to get them to Job Corps and drop them off and sending them care packages while they're there. Food worker cards, clothing and supplies for work, bus passes and gas I already mentioned, contingency rewards for achievement. So that looks like gift cards or coffees or lunches or things like that. You did something. Let's buy you cupcakes. Let's buy you a cake. Let's buy you balloons. Let's celebrate. Rental assistance and vehicle repair are kind of the more traditional things that you see offered by direct service providers. And then we also do a lot of finding out the court documents and the filing fees, because a lot of these young people do have a history of juvenile justice involvement or currently are involved in adult criminal court and don't really know like what information is they're currently working with, or what cases are open, or what those cases look like. And so being able to give them that information and put that power in their hands and allow them to respond to filings and things. In terms of how many young people we're talking about, we see about over 500 visits per month across our advocacy space and our recreation space. And over the lifetime of FYRE, which is, like I said before, about 2.5 years, we've served over 1,100 individual young people across Okanagan County. And that doesn't include, the events that we've had or the outreach that we do. We've seen outcomes in education. We've seen young people graduate. We've helped them get their GEDs. We've seen young people become housed. We've seen young people reunify with their kids. We've seen recovery. We've seen Narcan reversals. We've seen young people engage in some phase of recovery. We've seen employment exploration and young people do internships. In fact, several of those young people have done internships at FYRE and have worked in our recreation space. And I think the other things that are like the cascading effects of interaction with FYRE is that, as I mentioned, youth are navigating these spaces. They're learning how to navigate them. They're showing their peers. They're telling our highest referrals come from peers, not from community partners, although we do get those too. It's peer-to-peer referrals, young people encouraging other young people to engage and enroll in our services. And that's all I have. I see some questions. Do we have time for me to answer them or not?
Yes, please.
Okay. Let's
Am I your
see.
favorite employee?
That is the question.
Yes, yes, Alexi, but let's keep that on this Zoom, okay?
Thank you.
Okay. Chris asks, what sort of SUD treatment are you able to help youth access beyond immediate harm reduction efforts? So that's a good question, Chris. So I think for us, when we think about all of the young people who are, you know, what is that continuum of recovery? Yes, it does begin at Narcan, or yes, it does begin with love and belonging. But all along that continuum, we're talking about, you know, we are talking about all of these things being a part of that. A lot of our young people, how are you going to get into recovery if you don't have safe and sober housing, or you don't have the ability to help you navigate, you know, couch surfing situations that are going to be safer than other ones. And so there's that harm reduction space that we do. And we also have recovery coaches. So we have a recovery coach in our recreation space, and we also have a recovery coach in our advocacy space. And so that means that you're getting access to like that ongoing case management, and everybody here knows that this is what we're about. So all of our advocates, even though like we have somebody who, yeah, is more skilled at it than everybody else, everybody here knows that that's our game. Like, you do not exclude anyone because they are currently in active substance use. And so I think that alone is work that we're doing around substance use. In terms of formal treatment, we do try to get those young people that we're working with in advocacy to engage in, you know, with formal providers. So to engage in tribal behavioral health, to engage with their drug court. So we transport to drug court. We kind of help walk them through that process. We go to drug court with them. We, you know, ensure that they understand when their UAs are. We transport them to their UAs. We, you know, in the very beginning, we try to do a lot of reminders. We connect them to MATs, so medically assisted treatment through family health centers, and we have a partnership with family health centers to be able to do that and be very open about whether or not they're currently engaging in services through the MAT program. And also, you know, Alexi can tell you that, you know, she's done quite a bit of driving to try to get young people to detox and to also try to get them to inpatient as well. I don't know if that answered the question. Alexi can share more too.
Pretty good summary. I do think like at FYRE, a lot of it is really about navigating the systems for the young people, like, because so many of them like don't have a phone, they don't have, you know, a bus pass to even go up to like OBHC to get an evaluation done or something, you know, it's like, it's just super hard for them to navigate. And, you know, it's hard for me to navigate the systems. And I always think like, how like challenging and probably frustrating would it be to be a young person who wants to get help, but literally just can't figure out how to navigate the systems and or are treated, you know, poorly. And so I think a lot of that is just kind of getting them to the right place and then going with them in order to advocate so they get treated with the respect that they deserve. And, you know, they all know that I would do anything to get them to treatment. Like, I would drop everything. I would take a day off to drive them. Like, I would do anything to get them into recovery. Like, that's just how strongly and passionate I feel about that population of people. They're very important to me, and it's really hard to see how our community treats them. And that's tough.
Yeah, thank you for sharing that.
Any other questions came through? Do you see any in there, Maria? Okay. Well, thank you so much for sharing, and I love that you incorporated the vital conditions. That was great. I think, is Luke on? He was next on our agenda. Awesome.
Thank you, Michelle. Thanks for all that you do.
All right, am I good to start? I don't know how I'm going to follow up from Michelle. She put the vital conditions in her slideshow and I didn't do that. So I feel like I'm behind the game here, but I'm going to try my best to follow that. Can you all see my screen if I do that?
Yes.
Sweet. All right, it worked. Wonderful. Well, I am Luke. I am the executive director for Only 7 Seconds. I am super excited to be here. I'll jump right in by just sharing a little bit about who we are and what we do. As I talk about this, though, I do want to preface at the end of my talk, I'm going to share one of our stories, and I'll share what our stories are and why we do them. That story, there's a disclaimer beforehand. It runs for about 15 seconds, but I want to give everyone just time ahead of time, about 15 minutes in advance, that there are topics of suicide and a couple of other just mental health things in that video. So if you need to prepare yourself for that or potentially excuse yourself, I want to give you just 10 minutes of warning ahead of time for that. So that's coming. And it's an amazing video, super inspirational and powerful from a place of joy, but there are some difficult topics through that video. To get started today, so Only 7 Seconds, our mission is very specifically creating a world without loneliness. Sometimes I think it's a little bit of a grandiose attempt at tackling something that's a little bit oftentimes vague for people to define. And I'll explain why loneliness and what it is here in a minute. But really specifically doing this in a way that is all centered around connection by empowering people, communities, businesses, partners, to live more connected lives. And when it comes to the vital conditions, for us, it really is centered around that topic of belonging. When you are in a place of belonging, that sense of loneliness diminishes. And when you're in a place where you are alone, where you don't have a sense of people around you that can support you, where you don't have connection, it's similarly belonging just is really more difficult to find. And so there's really this kind of intersection of belonging and loneliness and connection that all kind of centers together. So specifically for us and why we started and why loneliness and why that really is the specific topic that we call out in the work that we do, is it initially started for me when I got involved was the US Surgeon General actually published a book about a month before COVID hits, ironically, and the book is called Together, and it's all about the #1 epidemic that he saw facing America, and that epidemic was loneliness. Most US Surgeon Generals talk about things like obesity, addiction, opioids when they retire and write books. And those are kind of some of the topics that they've spent time on. And he was really the first US Surgeon General to come out with talking about mental health, behavioral health, or in this case, really loneliness and connection. And as he toured the US and he intersected with every different demographic and group, he saw a consistent theme that loneliness was impacting people at every single level in every single sector. Didn't matter whether your race, religion, demographic, poverty, high level income, every single person was being impacted by loneliness. And so he wrote a book on it, really centered around this idea of building meaningful, intentional connection. And since that book, there's been a number of studies that have started to come out. And those studies really show two things. One, loneliness is impacting everyone. Nearly 80% of youth feel lonely. Youth are actually the loneliest demographic that exists. We oftentimes would associate loneliness with the aging population, but the reality is actually statistics and research shows that youth are feeling lonelier than any other group in America. It's about 80% of youth, and that statistic was actually pre-COVID. And so we know that it's only increased since then with some of the studies that have come forth since. Overall, it's about 61% of Americans feel lonely on a regular basis, regular meaning about once a week, they have feelings of severe loneliness. On the second thing that we know about loneliness is its impact. We're starting to learn that the impact of loneliness has real impact on both your mental and physical health. Examples of things like rates of suicidal ideation, depression, anxiety, and addiction all increase when there are significant, when loneliness is significant in that person's life. On the physical health side of things, we've learned things like loneliness increases rates of heart disease. It impacts the responsiveness to cancer treatments, and there's preliminary signs that it impacts dementia and type 2 diabetes. Even more interestingly, in the last 2 weeks, a study was published that showed the #1 predictive factor in school shootings was social isolation and loneliness in school shooters. That was the #1 predictive factor. So when we talk about this, we know that it has really direct impact. And I think similar to belonging and why belonging is kind of centered around those vital conditions, it has an impact in every aspect of what someone experiences in life. And everyone listening to this has experienced loneliness at some level, and everyone's experienced meaningful human connection. And it goes back to the beginning of time when we had to have, for our own survival, connection with other people in meaningful ways just to simply survive. So at a very high level, that's kind of why we do what we do. I could spend hours talking about the research that I've learned over the last few years on this. But I'm going to jump into just what we do. And really, there's 3 parts to it at this point. As an organization, many of you in North Central Washington have probably seen some of our things like our yard signs, different things that are out in the community. And really the intention with this part of our work is really starting to create this feeling of connectedness within community. We know that within that banner of belonging, that feeling connected to community is a big piece of that. And really that's the intention of a lot of our work here, whether it's spreading sticky notes on the 7th of every month across different cities and in different businesses. We have all sorts of businesses from law offices to coffee shops that have participated with some of our work. We've actually gotten to go and speak at some businesses where we just interact with the employees and help them develop more of a sense of connection and community within their own workplace. So this really is kind of under the premise of physical resources, and we provide those. You can order them on our website. You can come into our office. We have an office here in Chelan. And then on the 7th of every month, we just do community type of events. And then any sort of community events that we're invited to, we try as best we can to participate. We're a team of 3 right now, so our resources are fairly limited to get out to everything, but we try to show up to as many local North Central Washington events as possible. And then on the digital side of things, and this is where we serve not only North Central Washington, but really we have touch points all across the world at this point, is, okay, yeah, I won't jump into that quite yet. So our digital resources, we realize that loneliness is not something that is always going to be addressed in a community setting. Oftentimes the things that we talk about and things that we're trying to do and help people feel more connected, we know that we had to provide resources in a digital way as well. And so if you get on our website, there's a number of things that kind of fall under digital resources. We have a pretty comprehensive resource library from things like, if you're experiencing loneliness, here is a guide to kind of help you through that time of your life. We have a lot of referral resources. While we're not a direct service provider in most cases, we do refer people to direct services or resources as well. And then specifically, kind of the bulk of the digital resources that we've created is around storytelling. We created a project called the I Know Lonely Project. And the reason for that is we know that people feel less lonely if they hear stories that are similar to their own. If you're going through addiction and recovery and you hear stories of other people who have gone through addiction and recovery and are on some other side of that, they feel a little bit less alone in what they're experiencing. And then the other piece to storytelling is really helping flex that muscle of empathy. When we hear stories that aren't like ours and lean into those stories and engage with them, it allows us to engage in connection in more meaningful ways, that when we hear other people's stories, we can engage with those with empathy, and we can engage with them in really showing care for the other people around us, even if those stories are nothing at all like our own. So we share a lot of different stories. They run every year, September through May. We are wrapping up our final story of the first season this May, just in a couple of weeks. And the stories, we try to get a really wide range of different topics that we talk about, because we know that loneliness exists in every aspect of life. So for instance, I won't go through all of these, but these are the first set of 9 stories. They range from Kea in September, talks about her experience with bipolar disorder as a youth in high school and middle school. Mario talks about how he lost his mom as a middle schooler. He actually was homeless while in high school, experienced addiction, drug use, and alcohol use. Mac and Haley, Mac is a blind musician. Vic experienced incarceration and addiction. And kind of a range of number of different types of stories. And in fact, you all are the first group, and don't tell my staff that I've shared this with anyone at all. You're the first group that's going to get to see season 2's 9 storytellers. So starting in September, we will be launching season 2. And let's see if it works here. Yep, there it is. So these are the next set of 9 storytellers that will launch in September of this year. Once a month, we will share these videos. And these stories coming up range from everything from fatherlessness, suicide, being a part of the queer community and finding community within that. Mike is a 100-year-old World War II veteran and talks about the importance of friendship as he reflects back on his 100 years of life. There's eating disorder, physical disability. So a really wide range of topics that we try to cover, all with this idea of helping kids feel a little bit less alone in what they're experiencing, and not just youth, but all of us at some level. And then along with this is supplemented, like I mentioned, some of those digital resources on our website. And then we bring in these storytellers on our podcast as well. So these videos are 5 minutes in length. We supplement them with about an hour-long podcast where we actually have a conversation about what they experienced in life. And then we supplement those podcasts every month with some sort of resource or expert. So we brought in mental health experts. We just brought in a suicide prevention expert that talked about QPR training. So we really try to kind of supplement with resources along with this storytelling. And in a few minutes, I'll share a video of one of those storytellers, in fact, this month's video. But as I wrap up, just kind of what we do as an organization, and this is the piece that's really, really designed specific for youth, is our connection curriculum. So we take these pieces of storytelling, and for groups that want to dive into this in a real in-depth way with the youth that they interact with, they can do it through our connection curriculum. So the stories serve as kind of one of the base pieces of this, but it's a 9-part program where you can sit down with any number of kids. It can be with 2 kids. It can be up to, we recommend no more than 20 or 30 for a classroom size, but you can do breakout sessions. We have school districts that are doing school-wide assemblies every month, and then they do smaller breakouts. But it's a 9-month or 9-session program. Curriculum is a really academic term for what it actually is. It's really just an opportunity for kids to find a sense of belonging and connection with their peers. And so they learn to flex muscles like connection with themselves and better understanding their own story. They get to build community and connection with some of their peers around them. And then they also get to do things out in the community. So we do some things that are either within the school building or different types of activities that really help just build this muscle of meaningful human connection with the people around them. Yeah, and this is really what it's designed to do. We equip the teachers. So we oftentimes aren't the ones that go directly in. We provide the resources to anyone working with the students. Many after hours programs have been doing this, youth groups, boys and girls clubs, not only within North Central Washington, but we actually have groups all across the US that are participating with this now. Developing empathy, I mentioned, and then inspiring students to create connection, and then empowering students to connect with themselves, which I think I mentioned all those already. So future state, just kind of a real quick touch point on this is that we're working to adapt this to, right now, the curriculum is 6th through 12th grade. We're working to adapt it to where there's actually K through 5 materials as well. And then really starting to build the family support pieces as well, where parents can take this into the home. When it comes to impact, we actually have stories of parents that have listened to the podcast with their kids and have had serious in-depth discussions that would never have happened before. We have a couple of stories of people who have heard these stories, and because of hearing stories like their own, they felt like they could finally lean in and accept what they were experiencing themselves and go get help. We have 2 stories of people whose lives have been saved as a direct result of hearing and listening to stories that were like their own. They were in the process of taking their own life and chose not to because they heard stories and felt like they weren't the only ones who had experienced the things that they were going through. So when it comes to impact and outcomes, those are just a couple little touch points. I'm going to jump into, I don't even know how long I've been talking here. Okay, do I have time for a 5-minute video?
Absolutely.
Luke, before you move to that, do you mind answering? There's a question in the chat
Yes.
related to the stories that you shared. And Michelle was wondering if they are all local stories or.
Yes, great question. Most of them are, a few of them are not. And what I will say is, let me pull this back up really quickly. Most of them are local. So on average, let's see here. So like Chris, Kelly, Abby, Mike, Lori, Sammy are all local to North Central Washington or have roots here. But then Tyler is from the West Side, Rupa is from the West Side, and Kevin is actually from California. So we've pulled in a couple of storytellers because the diversity of story is not always easy to get all within North Central Washington, and we want to capture a pretty wide audience and different topics. So we've pulled in a few storytellers from outside of North Central, but heavy emphasis on most of them being located locally.
Awesome. Thanks for answering that, Luke.
Yeah, of course. Okay, I'm going to share. Let's make sure I got this. Okay, can you guys see that? And I'll blow it up.
Yes.
Perfect. And then next trick is the audio. So let's make sure the audio is working here. Can you hear the music?
Yeah.
Perfect. Okay.
My name is Izzy Boring. I have 4 brothers, and just being around them all the time and them playing basketball around me, I kind of switched it early on. And at the age of 6, I started playing basketball, and I kind of just like threw away my pom-poms, and I was like, this is what I want to do for the rest of my life. When I was 8, my dad actually got sent to prison, and it was kind of very scary being the only girl and not having your dad to look up to. And I definitely got bullied a lot in school for not having my dad around, and all the daddy-daughter dances that I didn't get to go to. We did have a broken family for a little bit, and it was just hard to almost like move on every single day and be okay with it. My mom is amazing. She's probably the strongest woman I've ever met in my life. And when we were growing up, she actually lost both of her parents to cancer. And while my dad was incarcerated, she found out that she had breast cancer as well. And the way I saw her hold on to her faith and rely on that foundation has just inspired me in my walk in my faith. And just to see her raise 5 kids, work 3 jobs, deal with the cancer, and then deal with her husband being away, and then still have a smile on her face and still be there for everyone. It was super amazing. I met my boyfriend Cade in my freshman year. We both connected mostly just around basketball and things like that. And it was funny because he ended up winning state and he was the MVP. And so every single girl in the state was texting him. And I was like, oh, like I'm kind of lucky I texted him before everyone else did, like perfect timing. And we ended up FaceTiming each other. We did like Bible studies over FaceTime. And I thought that was super cool. The first time we met, to me, it felt like a movie. It felt like I was living like every girl's dream. And it was cool because on my birthday, he came and surprised me, and we left my house at 3 a.m. and we went to go jump into Coeur d'Alene Lake, and it was freezing, but it was like the most coolest thing ever because I'm a super spontaneous and adventurous person, and the fact that he like almost took a liking to that and wanted to be a part of it was super cool to me. As we started dating, I just saw him open up and just kind of like let God into his life more, and it was just super special to see. And he would start leading prayers on FaceTime, or he would just like pull me aside during the day and be like, hey, like I think we need to pray about this. Every moment I spent apart from him was so hard. It was like a piece of me was like gone the whole time. we were driving home from a basketball practice that I had. And he was like, I need you to pinky promise me that you're going to marry me. And so we did. And like, it's going to be me and you forever. And he's like, yes, me and you forever and always. And the next day on March 17th, I woke up and everything was super normal. And I opened up my phone to this text message and it was just him apologizing. And he was like, Izzy, I am so sorry that I'm about to do this to you and to my family. And there's a lot going through my mind. And then he just said he's sorry. And he's like, I love you so much. And I hope you know that. I have days where it's like, I don't think it's real. And I think he's just going to pull up one day and say hi. Or there are days when I'm angry and I'm like, why? Like, why would he do that? And I told my mom, I was like, I can't go on without him. Like, face the fact that I'm not going to see him. And like, you have all these questions, like, what did I do wrong? Or why wasn't I enough for him? Or things like that. The whole grieving process, I don't think there's a right way to do it. I don't think there's a wrong way to do it. I think everybody's journey is different along it. But I've also like found a new purpose almost. And for me personally, just like my faith has helped me tremendously. I didn't plan for this, and God never planned to hurt me or hurt anyone else, but he knew it was going to happen. And so he equipped me for this journey. And I've come to realize that sometimes like God will use my struggle to help other people. And I think that has given me so much purpose, and God's given me so many beautiful relationships that I never would have found or never would have encountered. Just the way I've seen him transform my heart and be a light to people who are maybe dealing with this or dealing with something different has been remarkable. And just the messages that I've seen where kids are like, Cade's story literally saved my life. If there's anyone out there who is struggling or feeling overwhelmed, I just want to tell you that you do matter. And whether you believe it or not, or whether you see it or not, there are so many people in your corner, and there's so many people who love you. And through my experience, I've seen someone take their own life, and I've seen a whole community be there. And I just want to encourage you to be brave, and that it's okay to not be okay, and it's okay to be struggling right now. Life is not always perfect, and you have to experience the bad to experience the good. Your story has yet to begin, and there's still pages that are waiting to be written on, and there's still stories that you need to read, and there's stories that people need to hear from you. And I promise you that no matter how hard it is, one day you'll be able to sit there and say you overcame, and you get to say that you made it and that you've pushed through, and that story will impact a lot of people. So I just encourage you that as long as you keep fighting and you keep breathing, then you're on the right track. I realized that it only takes 7 seconds to share my story.
I still have a hard time watching that still. But I hope that video just gave a little insight into some of what we talk about and do, really with the intention of kids feeling a little bit less alone in what they're experiencing, and being an inspiration to what they're going through. So I'll wrap up with that. I hate ending on that, but I also feel like it's just the story to me is so moving and powerful, and to speak from a place of rawness that and to do that as an 18-year-old kid, she's still amazing. And so I would encourage you, like, if you have people that these stories might be even relevant in your own lives, feel free to share them with them. They go out every month throughout the school year, and then summertime we'll supplement with some other stuff. But are there any questions about our work or what we do or why we do it?
Kind of curious if you, are you a faith-based organization, or did that just happen to be a person who was?
No, we absolutely are not. It just happened to be that her story, and April is the month that hers went live. So she talks about faith. But our topics, we have Vic, who is Hindu. We have various different faiths and beliefs that are talked about throughout our stories, bringing in all different types of populations. And the intention really is that the topic of loneliness, human connection, belonging impacts every person at every level. And we would do a disservice if we only shared one perspective or one type of story in the work that we do. And so we really try to diversify and talk about everyone's perspective, because regardless of your own perspective or belief on the world, this is relevant to each and every one of us.
Yeah, thank you.
Thank you.
Yeah, of course.
Unless there were any other questions in the chat that we missed, I don't see any other in person. Thank you so much for sharing and being here today, Luke.
Absolutely. Thanks for having me.
All right, we have Alyssa is here in person and she's gonna share about Hope Squad. I didn't know, was there anything you wanted me to pull up or you're just gonna chat?
Yeah, if we have time at the end, maybe bring up one of our videos.
Great.
But one of the one. Perfect.
Okay.
Geez, Luke, thanks. That's really hard to follow. And I think it's also a great setup to Hope Squad. So for those of you that don't know me, my name is Alyssa Polson. I am with Together for Youth. And I am the regional Hope Squad coordinator. So here in North Central Washington, we do have Hope Squad in Chelan, Grant, Okanagan, and Douglas counties. So Hope Squad was actually founded in Provo, Utah by a retired school principal. And he was actually at an elementary school and had to go down to their local precinct one night to identify the bodies of one of his students. And so they wanted to come up with a way to kind of prevent this from happening. So they came up with a peer-to-peer system. So because a lot of times when we hear about students having suicide ideation, they tell a friend, and the kids just don't know what to do with that information. They don't know who to talk to. So the idea with Hope Squad is to get kids talking about their mental health and really getting the help they need. So that's kind of how Hope Squad came to be. We have a grant in North Central Washington through now Thriving Together. So we are hoping to get up to 48 schools in North Central Washington. Right now we have about 27 actively participating. And we have about 9 schools in Chelan County, 9 schools in Douglas, 6 in Grant, and 5 in Okanagan. So we are really trying to get this program up and running and thriving. So I don't know, I think Luke had talked about the loneliness part of it, but I also wanted to talk about the Healthy Youth Survey a little bit. And what we found from last year's Healthy Youth Survey. I don't know if everybody's familiar with the Healthy Youth Survey. But it is a survey sent in schools for 8th and 10th graders. And it goes through a series of questions of mental health and just different criteria. And the results from last year in our region alone is kids were having depressive thoughts at about 40% in our 4 counties. And out of that 40%, 20% had thought about suicide. So with Hope Squad, peers are actually nominating their classmates to be a part of the program. And so they go through, it is an evidence-based program. And so they go through a curriculum through the year that goes through different topics, including mental health and bullying prevention and adversity and all sorts of things. So I don't know what it is. I apologize. I did not do a PowerPoint. I was running around this week. So yeah, I mean, here in North Central Washington, we did do a 3-part video to kind of represent Hope Squad and show it what it looks like in the schools. So we can absolutely share that.
I didn't catch the lot when you said which one.
The Waterville Wall Loop one would be great. Is there any questions about Hope Squad?
The third one.
I think it is the third one, yeah. And these, so we have 3 videos. It's Waterville Wall Loop and Pateris has one, as well as Pioneer Middle School in Wenatchee. And all of these can be found on the Together for Youth website, as well as, are you guys still the NCACH YouTube?
I think we're renamed now.
Yeah, it is renamed. Yeah, I'll pull it up here.
So the Thriving Together YouTube channel.
And we did just start onboarding elementary schools.
Yes.
So there's middle school, high school was the original focus. And then we recently, so how many elementary schools do you have now?
We are probably close to about 10 elementary schools, with the rest being junior high, high school.
And so they have a separate curriculum that's
Yeah.
more geared towards that age group.
So the elementary is more, rather than being focused on suicide prevention, it's more leading on topics that can lead to suicide prevention, such as bullying and isolation and things like that.
Are you in Okanagan?
Yes, so we, Okanagan High School, Middle School does have a squad, as well as OMAC High School. The middle school was having some staffing changes and was never able to implement it, but they are on the list of trying to get it going.
For the grade school or for, are you talking about
OMAC Middle School.
Is it, so there's nothing in the elementaries?
Not yet, no.
What if we wanted it? How do we get
Absolutely.
it?
Please email me. If you guys know of any schools that would be interested in implementing Hope Squad, we're still accepting applications. I can give you my business card after we're done here.
That'd be lovely, thank you.
Yes.
So I'm just not sure if it'll, the volume, since I'm,
Gotcha. Would it work on Mariah's? If it doesn't work, we can just send the links.
yeah. Cause I think if I turn my volume on, it'll not work with the owl.
And I will send out all of these resources afterwards. So we'll send the videos, presentations. For those that are in the room, there are some handouts that show the kind of the flow sheet of crisis services for Grant County and Chelan Douglas County. That Dr. Rickard, who was unable to join us today, worked alongside Renew, and then Steve Hightower at Catholic Charities for those specific flow sheets. And so those are resources that I will share out so that we can share with those.
I was gonna say, maybe Caroline could, if I put this in chat, if she could share screen.
I was looking.
Yep, I can try that.
Perfect, thanks, Caroline.
Okay, let me stop share.
All right. I gotta make sure I'm gonna share my audio. Second. Share sound. That's the magic trick, everybody. On Zoom, if you're sharing a video, you want to go to share sound, and then it should tap the audio in.
Thanks, Caroline.
It's benefited me just because I've seen there is cases where people are really like down bad, just that they don't show it, or they could be depressed, or thoughts of suicide. And like now with the surveys and tests we've done and homework we've done, it's like taught us like signs that tell if someone's a little depressed or thoughts of suicide.
The reason why I decided to be part of this program is because I saw there was a high number of increase of suicide attempts, and I want to try to make those numbers not rise up too much and just try to help students who are in need.
Kids are starting to know and ask other students questions, that are in Hope Squad, like, yeah, how does Hope Squad work? What is it? So our fellow peer students have been asking, like, hey, how do we explain to them what it is Hope Squad? And they gotten the hang of it, so they've been doing pretty good.
I like to be part of Hope Squad because I get to talk with other students, engage with them, just try to help them in the smallest ways that I can, try to encourage them that they're not alone, that we have people who actually care about them and want to speak to them and help them throughout the problems that they have.
It's so important because, it helps the youth understand what we do and have them, if we as advisors can't get to them first, we have our members that can actually talk to them and help us, hey, we have this student who needs help.
I feel, in my opinion, most parents still believe in mental health. So if the parents are there to believe, we can help those students that it is important that they're not alone. Because I feel most parents shut their kids down on mental health, or they just don't want to talk about it. But it's actually an important topic to talk about because it can lead to death or any self-harm.
They normally just look at their kids and be like, you wouldn't, right? You love us and whatever. And we're like, you don't know that, he will love you, I guarantee you that, but he could be really depressed or inside. That's why they recruited us, and that's why we made Hope Squad here at the Wahluke High School and the junior high a thing, so we can help your students and listen to your students because they need someone to listen to them.
My name is Jill Numa. I am the school counselor here at Waterville, and I'm also the Hope Squad advisor. The Hope Squad program is a peer-to-peer intervention program that their goal is to reduce youth suicide and by providing education and opportunities for kids to learn how to really be a part of something that educates them on suicide prevention and emotional health.
My name is Julia Ashley, and my role as a Hope Squad member is to help spread hope and help our students feel less alone. I think the main thing is we talk about it and going to classes and making sure people understand that it's okay to reach out for help and just kind of destigmatize it.
Although it takes time and effort to put programs like this into place, the advantages far outweigh the disadvantages, because when you're talking about the topic of suicide prevention, obviously one life matters. Whatever we can do to kind of just integrate, some of the ideas of suicide prevention throughout all activities and events, that's going to really, in essence, expand the awareness at large in our community.
You like how I figured out the volume there? I was just looking at the clock. I was trying to transition us back.
Thank you so much for sharing. Yeah, I just love that video. I think it really does a great job of showing the diversity in our area. And I mean, our kids do a great job. They know their roles and are very active with Hope Squad and in their communities. I mean, I could share stories all day long, but I do know some of our schools, some of the students have actually called 911 with other students to be able to help that issue. One of the big things that we are working on right now is our Hope Squad conference. It is a regional conference for all of our Hope Squad members and advisors. And we are opening it up to school districts that may not have Hope Squad. So administration, if you have any contacts with administration in our area that would like to attend, we are going to have the founder of Hope Squad, Dr. Greg Hudnall, be a keynote speaker. So yeah, Mariah has my email, so she can send them out. If you know of anybody that would be interested, please feel free to reach out to me.
And I will include information on that in the follow-up email that I'll send out next week.
Any questions for Alyssa?
Very good job.
Yeah, thank you. All right, well, that wraps us up. I know Mariah had noted a couple times that we'll be sharing out some resources and contact information. So if you have any follow-up questions that you weren't able to ask, you can definitely reach out to us or use that contact information for the guest speakers that we had here today. And as always, we record these sessions, so we will get this up on our YouTube channel if you wanted to revisit any of the topics or share this information with any of your colleagues. So thank you so much. We will wrap up the Zoom portion and the rest of us are going to go